of cancer research charities are looking to technology to help curb and change how ovarian cancer gets diagnosed. So joining me now is Ovarian Cancer Research Alliance CEO Audra Moran to talk about using AI more with this. Thank you so much for joining us here live on Fox 5 this morning.
Hi, good morning. Thank you for having me.
Absolutely. Now, before we get to how artificial intelligence is being used, break down for us ovarian cancer rates and why it's so important to use this technology in the research.
Yeah, we haven't seen a lot of movement on survival rates for ovarian cancer, and it's the deadliest of the gynecologic cancers. It's about a 52% survival rate after 5 years. So obviously we want to impact that. That needs to get better now.
So how can artificial intelligence be used, and how is it being used currently?
Well, it's seen a lot of success in other disease areas, so like breast cancer and prostate cancer, cervical cancer. So that's really exciting. And we think that we can apply those learnings to ovarian cancer and finding an early detection method, which would be amazing. We now know we need to detect ovarian cancer much earlier, even before symptoms onset. So, I mean, that's going to be what AI can help us do, or biomarker discovery, helping us locate it, better treatments. So there's so many implications, and we're really excited to be working in this space.
In a practical sense, how does that work? What does the implementation look like, especially when it comes to screening, for instance, with AI?
Yeah, well, right now there is no methods of early detection for ovarian cancer, and there's no screening method that has impacted mortality rates. And so we think that it has to be caught much, much earlier, like 5 years before perhaps you even go to a doctor with symptoms. And AI has the potential at this point to do that. We have one researcher right now, one researcher that we're funding that is actually looking at a blood test, but it would be for a very early identification.
And I know, too, that ovarian cancer is certainly broad, like other cancers. Why do you believe that the research isn't as far along as perhaps it should be when you compare it to other conditions out there?
A good question. Really, there's more than one type of ovarian cancer, so it's a really heterogeneous disease. It's not just one disease. It's lots of different diseases, and I think scientists are just starting to kind of understand that. We also know that most ovarian cancer actually starts in the fallopian tubes, and this has been a recent finding in the last several years, and that's exciting, but obviously we have a long way to go.
And research, technology, all of that certainly takes time. What do you want our viewers to know, just in general, when it comes to ovarian cancer screenings and research? What do they need to know today to better protect themselves moving forward?
Well, it's always important to know your risk. We actually have a genetic test that you can take. It's like a little quiz on our website, and you can get free genetic testing. So it's always important to know the risk. Discuss your family history with your doctor, and those are really important things. But, right now we're very focused on launching this really big grant today, and it's actually a $1 million grant for AI so that we can help people with early detection at some point.
That's an incredible move forward, especially with this grant. How can we all join in and help? Because it does take funding.
Yes, it absolutely does, and thank you. Visit ocrahope.org. We have donate buttons, obviously, but it would be also great for people to educate themselves and to learn a little bit more about the disease. You can read about some of our other AI grants. We partner with Microsoft and their AI Lab for Good. You can check that out on our website as well.
That is just incredible. And I think, too, you mentioned the fallopian tubes. Just that little nugget is something that people can take to their doctors when they're being checked.
It absolutely is.
Because you have to be your own best health advocate.
You sure do. And, if you're having another pelvic surgery and you're done having children, you can actually talk to your doctor about opportunistic self-injectomy. And that's having your fallopian tubes removed without removing your ovaries, which can reduce risk as well.
All right. Well, thank you so much for joining us, Audra Moran, CEO of Ovarian Cancer Research Alliance. We appreciate your time, what you do, and congrats again on the grant funding. We'll have to check back in a few months to see how everything is going. All right.
Thanks for having me.
Thank you.